Whoa, where the heck am I? All right, Professor Klein back here with you for the final PowerPoint of the upper extremity, the wrist to the hand. I had to go Pirates of the Caribbean theme on this one, and you'll know why in a few slides. So you can call me a pirate with my pet pirate right here as well, but it is a theme to get us into the final part of the upper extremity, the hand. All right, so with the hand, let's dive into some of these bones here. And we can see, finally, the carpal bones. All the carpal bones, there's 8 of them total. And coming off the carpal bones was just like taking a bunch of different pebbles and stuffing them together. And when you do that, you get a collection of carpal bones. We can see the metacarpals 1 through 5 and phalanges, which we've gone over already, but really start to focus on some things. For example, there's a proximal and distal end to each phalange, just like a distal and proximal end of each metacarpal. There's a shaft or middle region as well. Sometimes there's other bones coming off of those bones themselves, and many different shapes within the carpals themselves. But on top of the bones, and if you feel in your hand, you can feel those bones, but on top of that, we've got muscle and a lot of connective tissue. So the hand itself has a ton of connective tissue. For example, something called the palmar aponeurosis, which is this big band of connective tissue in the middle. Feel the middle of your palm. Feel how it's kind of dips down in, it's deeper. But then feel either your pinky finger or your thumb. And what you'll feel is more of a meaty part or more muscular. And that's because there's not as much connective tissue at the base of the thumb, at the base of the pinky finger, but in the middle, there definitely is. Well, we'll get to the muscles. Let's start with the bones. And here we can see the 8 different bones on an X-ray. And I like using an X-ray picture as well as just a normal picture of the bones. These are carpals that are going to glide and kind of move and have a lot of muscle attachments. But I want you to look at the notes of this PowerPoint to see what I'm about to tell you next, which is a foolproof way, in my opinion, foolproof way to remember these bones. Now, there's a lot of mnemonics out there that are going lateral to medial, first row, second row, whatever. If you want to use one of those, use one of those. But I go off of shape, size, and location of each bone. Because, for example, could you tell me if this is a right or left hand of the body? Right or left hand? You tell me, take 5 seconds to think about it. If you said this was a right hand, you would be correct. If you're looking at it, what you can see here are the 2 wrist bones, ulna and radius, parallel to one another, but the thumb is on the right. So if you look at your right hand, go ahead and look at your right hand, palm side facing you, you should see the same as you do in the X-ray. All right, let's go through the way that I remember these, and I get it kicked off with the first one. And the reason why I'm dressed as a pirate here on a pirate ship is because there is a muscle called the capitate. Capitate, I think of captain. This is like the captain of a ship. And if you look here, I'm going to outline it for you. It's one of the biggest carpal bones, and it's in the middle of all the other ones. It's in line with the third digit. Now, to me, when you're a captain of a ship, you're in the middle, you're the biggest, you're the strongest, you're the most powerful. You've got control, especially if you're grabbing the helm here of the ship. That's the capitate. And it doesn't matter if you're looking at this view or this view, you can tell the biggest bone, biggest carpal, in line with the third digit, is always going to be the capitate. So that one gets us kicked off. The next one, though, the hamate, is another pirate reference. Mate, like first mate on a ship. This is going to be the one right next to the capitate, or next to the captain. It's smaller. It's not as powerful as the captain, but it's in line with the fourth and fifth digits. Now, if you marry somebody, they become your spouse or your mate, and you put a ring on the fourth digit. So that's your ring finger, and that lines up with the hamate. So two things there for you to help you remember the hamate. All right, jump to a different view of it, and you always want to look for some other bony landmarks. I'm going to pull myself up into the window here because I want you to look at the hook of hamate. Again, first mate on a boat, and if you're a pirate, you might have a hook. I must have misplaced my hook, but this hook right here is a bony projection coming off of the anterior side of the hamate. We call that the hook of hamate. Keep going, and the next one is called the triquetrum. Triquetrum sounds like three. It's a triangular shaped bone in line with the pinky. Now, I say that because you can see it down here. Let me pull myself up again here. You can see it down here, but if you were to look, it would be right here with another bone, the pisiform, on top of the triquetrum. So you can't see it from a posterior view, but from an anterior view, you can see the pisiform on top of the triquetrum. I always remember that the pisiform starts with a P. The fifth digit is the pinky. That starts with a P, and that runs down to the triquetrum and the pisiform. All right, on an X-ray, you won't really be able to see the difference between those two. But back here is that triquetrum. On top, the P-shaped one is the pisiform in line with the fifth digit. Next up, the lunate, lunar. It's got a moon or crescent-like shape to it. So moon-like or crescent-like shape. And it's next to, it's called the scaphoid. Tough to see here, but the scaphoid is actually S-shaped. It's got an S shape to it, and the scaphoid is in line with the first and second digits. Here we can see that lunate and that scaphoid, and the lunate is right here. Scaphoid's right here. Take a look at the scaphoid up top. You start to see that S-type shape to it for the scaphoid. Two left, two of my favorites. First one is the trapezium. Trapezium is a bone that's in line with the thumb. First digit. So I say the trapezium is in line with the thumb. Kind of rhymes. Try it out, see if it works for you. But then the final one is the trapezoid. The trapezoid is small, as you can see it here. And guess what? It's trapped in between the trapezium and the capitate. So if you're like, okay, where is this one? Look for it trapped in between both those. That's the trapezoid. Back to this one here, you can see the trapezoid, or rather the trapezium, coming down the first digit and the trapezoid right next to it. So trapezium in line with the thumb, trapezoid, TD, wedged in between the capitulum and the trapezium. So those are the 8 different carpal bones. I'm not going to take them out individually and ask you to name them, but I will ask you to name them when they are together like this. So I might pick out the capitulum and say, what is this bone right here? Hand and carpal bone video, not from my channel, but a different channel that can help you out, as well as the Ackland Anatomy website. I highly encourage using this website to help you learn these bones and muscles of the hand. All right, next up, let's divide the hand into 2 different sides. First, we've got the thenar, or the thumb side. So thenar, I want you to think thumb. Hypothenar, 5th digit, pinky. And looking at a cadaver picture here, we do want to note the thenar region and the hypothenar region with their own muscles. But remember, we've got tendons coming down all the way from the forearm that will be traveling through the hand or to the thumb, as well as nerves. So you tell me, what was the nerve that travels straight down into the thenar, or thumb side? Do you guys remember that middle nerve? Hopefully the word middle helped you. It's the median nerve right here going to the thumb. Well, guess what? We got another one on this side going to the hypothenar side. And you can tell me that one right now because it's the ulnar nerve. 2 major nerves of the hand. Don't lie to us, Professor Klein. There's a 3rd major nerve, and it's on the posterior side, and that's the radial nerve. So remember all 3 of them, and you'll be good for the hand. So back to that palmar fascia being this big, thick band of connective tissue pushing down on the palm. It keeps the muscles tight against the hand itself. There's also a plantar fascia in your foot. So remember all those body regions? They're really playing a part now that we're looking at some of these things. Now, it's a very thick layer of aponeurosis, aka deep fascia. It's strong. It's going to keep things in, as well as it's got 4 longitudinal bands in line with digits 2 through 5. Let's look at a transverse cross-section of these items here, and you can start to see different compartments. So we've got a hypothenar compartment. We've got a thenar compartment. We've got this central compartment, as well as an adductor compartment in there as well. And you start to see some of the names of these muscles very similar to the names in the forearm: adductor pollicis, pollex thumb, adductor. It's going to tell you what it does within the name of the muscle. All right, on the posterior side of the dorsal side, we don't have nearly as much aponeurosis going on here. We do have that extensor retinaculum, just like we had a flexor retinaculum on the anterior side, but we also have something called the extensor expansion, aka dorsal expansion. And this one's going to expand from the extensor digitorum tendons that extend the fingers all the way down to the flexor digitorum profundus and superficialis that flex the finger. So know there's this connection between the anterior and posterior side called the extensor expansion, aka dorsal expansion. And much like we had the flexor retinaculum and extensor retinaculum that prevented the bowstringing in the wrist, well, guess what? We've got the same type of setup in the finger with these digital sheaths that are called annular ligaments that wrap over the tendons and hold them tight to the finger. So if you didn't have these, the tendons will bowstring off the actual fingers. Notice here how the tendons stay very close to the bone. It's like giving the bone a bear hug and holding it nice and tight. Another great picture of it shown right here. Oh, we got a little bit of an issue back here with who the actual captain is, so I gotta go take care of this. In the meantime, what I want you to do is go through all the carpal bones. Try to draw it out, draw the hand bones, get ready for some muscles coming soon. Take some time, do that right now. All right, I'm back here. We got that taken care of, and we are ready to get on to the next part and really diving into the digital sheaths of the finger. It is a complex system. Now, if we're looking at tendons here, tendon going through the synovial sheath, just an outer covering, but notice again those annular ligaments wrapping around the finger tendons themselves. But I also want you to note something else. I want you to note the collateral ligaments. There's a collateral ligament on either side of the finger at each joint. So just to label these, this would be the MCP joint, this would be the PIP joint, and then we've got the DIP joint right here. Each of them has a collateral ligament. All right, keep it going. Let's just review those finger movements as we look at abduction, fingers separating, adduction, fingers come together. You can extend the different joints. Here's me extending all the finger joints, but you can also flex certain joints while keeping others extended. Take a look at these photos. They really help break down flexion and extension at each joint. Now here we can see the muscles of the hand. I've broken it down into the thenar muscles and the hypo and the adductor compartment, and you can start to see the different divisions of each. So if we look at the thenar, something called the abductor pollicis brevis, that's going to be this muscle right here. And this muscle, if I outline it for you, if it contracts, it will pull or abduct the thumb to the side. In the name, it will tell you what it does. Just like the flexor pollicis brevis right here, it's a little bit underneath it. It's going to flex the thumb right here. Now, multiple layers, and actually this has a superficial and a deep head. So they're just showing the superficial head. There also is a deep one. Opponens pollicis, opposition. And for the nerve, it's always going to be the median nerve, except for the deep head of the flexor pollicis brevis. That's going to be the ulnar nerve. So everything with the thumb is median, except the deep head of the ulnar nerve. What else is ulnar? Well, everything over in the hypothenar group. Glad you asked that question, because we can group everything in the hypothenar group. Abductor digiti minimi, flexor digiti minimi brevis, opponens digiti minimi. That's a lot of words for those muscles, but they're all the ulnar nerve. Also notice how the muscles that abduct, like this one right here, the abductor digiti minimi, It's most lateral. When a muscle is most lateral, that means it's going to pull laterally. If a muscle is medial, and that's like the adductor pollicis, which is part of our final group, there's a transverse and oblique head, that's going to pull inward and adduct the thumb. That's what you want to look at, is where are the fibers pulling. Function follows form, follow the fibers, and you'll know the action. And that deep one is the ulnar nerve as well. So you could start to say everything hypothenar plus the adductors plus the deep head of the ulnar, or the deep head of the flexor pollicis brevis, is going to be ulnar. And here's a table for you. Again, you don't need to know the origins and the insertions. They're very small and they don't really have a ton of clinical relevance, but you do need to know the nerve, the action, and the name of the muscle, and how to identify it if shown a picture. Let's look deeper at those thenar muscles because there's multiple different layers. The thumb can move all around. So lots of different movements for the thumb, including a new one called opposition, bringing the thumb and the pinky together. Now, if we look down here, in addition to that abductor pollicis brevis, which is on top, most superficial, if you cut that and you also cut the superficial head of the flexor pollicis brevis, you can see the adductors. So the adductors, and specifically the adductor pollicis, transverse and oblique head. Transverse, it's all about the fiber direction. Transverse meaning straight across, that's the adductor pollicis transverse head. Oblique, take a look here. Now we're going in an oblique direction for the fibers. Both of them, though, are going to do adduction, bringing the thumb over the middle of the finger, and that's the adductor compartment. Here's another look at the thumb movements. We saw this a little bit earlier with the fingers, but now we're seeing it with the thumb, and we can go abduction, adduction, extension, flexion, opposition, reposition. So notice how something like abduction is similar to extension. I like to take my other hand and pull that thumb back into extension, right? That would be extension. Abduction would be straight to the side. Adduction across the middle. Flexion down like that, and then opposition, a combination pinky to thumb. And again, don't forget the forearm muscles that go all the way down to the fingers and how that would look, like you can see in this video here, flexing and extending the hand. All right, we're not done yet, but take a second. If you're like, whoa, what did Professor Klein just go through? Take a second to draw out the thenar muscles, because now we're going even deeper into the hand. And when we go deeper, we can see something called the lumbricals. Lumbricals are these muscles here branching off of the flexor digitorum profundus. So these tendons coming down, they actually are attachment points for the lumbricals. And the lumbricals insert on the digital or dorsal digital expansion. Remember I said out at the finger, connecting the different extensor muscles and flexor muscles. That's what's going on right here, and that's the lumbricals. We'll look at their action in a second, but there's also interossei, even deeper on the dorsal and palmar sides. All right, let's look at the lumbricals just by themselves, and here we can really see how they branch off of that flexor digitorum profundus tendon. Common exam question is, what tendons does do the lumbricals branch off of? Now here's where it gets complex. I want you to divide it right down the middle here into digits 5, 4, 3, and 2, and digits 2 and 3 those lumbricals are going to be the median nerve. They're closest to the thumb. And then digits 4 and 5 are the ulnar. These right here, because they're closer to the 5th digit, which is the ulnar nerve. Here's the action of the lumbricals. You're going to flex the MCP joint, but extend the PIP and the DIP joints here. So you can also see it down here. It kind of forms kind of a plank-like structure to it, a plank-like structure. And the lumbricals are literally pulling down to keep it straight up here, but then flexing at that MCP joint. Let's get to those interossei, very similar to the lumbricals, but deeper. In the interossei, the dorsal ones are going to abduct, and we say pad dab. And when you say the letters dab, not this dab, but dabbing is abducting, you're going to use your D dorsal interossei. So dorsal interossei, I hope that made sense. Dorsal interossei, the D stands for dorsal, the AB stands for abduction. What's that again? It's abducting, spreading the fingers apart as much as possible. Notice though, why does the 5th digit and the 1st digit not have dorsal interossei? Take a second, think about why the 1st and 5th digit do not have dorsal interossei. All right, hopefully you paused the video and had a chance to think about it. Well, if you go back to the hand muscles, they have their own specific abductor muscles. Remember the abductor pollicis brevis and the abductor digiti minimi? Those would be here for the digiti minimi and here for the abductor pollicis brevis. So they don't need dorsal interossei. They have their own specific muscles. And this is the ulnar nerve because it's deep, and the deep muscles of the hand are the ulnar nerve. Next up, the palmar interossei, pad, P for palmar, AD for adduction. This is going to bring the fingers real close together. And what you'll notice is there's one on the 2nd digit, the 4th digit, and the 5th digit. Another question, why not the 1st and why not the 3rd? If this muscle adducts these fingers, take a second to think about it. And if you apply the same logic and reasoning as the dorsal interossei question, you'll have said that, well, there's already a muscle, the adductor pollicis brevis, that adducts the thumb. So the thumb doesn't need palmar interossei. But that 3rd digit, that's a deeper question. And the answer is that the 3rd digit, it's already as medial as you can go. You cannot adduct the middle finger more than it is naturally, right? So everything, and if I draw a dotted line here, everything is going to the center line when you adduct, and that center line is the 3rd digit. So no palmar interossei for the 3rd digit, ulnar nerve, because these are deep. Here's another look at the lumbricals pulling downward to form that plank flexion at the MCP, extension at the PIP and the DIP joints, but you can also see the palmar interossei in there as well as the dorsal interossei pulling to form that position. Back here, we've done a good majority of the area. We're going to start to look at some of the different tendons traveling through this tunnel, and this is the classic carpal tunnel. So the flexor retinaculum as the most superficial layer, but then this compartment here with the bones underneath is the carpal tunnel, and look at all those tendons traveling through the carpal tunnel. We often think of carpal tunnel as that pain that you feel in your wrist, and that's the tunnel that we're talking about right there. So with a lot of these, we'll talk about these together. Let's say you lose that ulnar nerve. What's it going to look like in the hand? Well, we said ulnar nerve was everything with the pinky, fifth digit, and then the deep muscles of the thumb. So one of the deep muscles would be the adductor pollicis brevis, as well as that first dorsal interossei on the second digit. So you might actually see some atrophy or a kind of a divot where a muscle should be if the ulnar nerve stops working. Quick reminder of the arteries before we look at the carpal tunnel. We know that radial artery is coming down and traveling to the palmar arches, deep and superficial palmar arches, as well as the ulnar artery is traveling in this direction as well. Here's a cadaver picture of that palmar arch, very prominent arch, supplying the different fingers with blood. Now, clinically, if you have a laceration of the hand, you want to occlude it further up at the wrist or the elbow or even the brachial artery. That's the next place where you could really occlude it and stop blood flow to the hand, because you do not want to lose any more blood through that area. All right, let's start to look at the carpal tunnel issue here. And here we can really see the median nerve traveling straight through and then go into the thumb, as well as the lumbricals of the second and third digits right up there. Do notice the ulnar nerve. The ulnar nerve is outside the carpal tunnel. So it's not inside the carpal tunnel like the median nerve. So the median nerve is the one that causes issues for carpal tunnel. And don't forget about the radial. Even though it doesn't innervate anything intrinsically, remember it does do the posterior extension muscles coming from the forearm. All right, here is carpal tunnel from a transverse cut. And as you can see, many different tendons in here, and then that nerve, let me clear that nerve, median nerve, wedged in between there. So it's really, if these tendons get too inflamed or they push onto this nerve, you're gonna feel that pain. So again, the pain is coming from the nerve itself. So notice it's flexor digitorum superficialis tendons, flexor digitorum profundus tendons, as well as the flexor pollicis longus tendon right here. So you got 9 different tendons, 4 from each flexor digitorum, and then you've got 1 over here, 9 plus that nerve. It can get kind of crowded in the carpal tunnel. So what happens? Well, the muscles that are innervated by the median nerve, they start to shut off, as well as the sensory areas of those things as well. So we know the median nerve goes to C6 through C8. That's kind of like this purple region here. You start to get the tingly feeling in your thumb and first couple fingers. That's paresthesia. Hypothesia is decreased sensation, and then loss of any sort of tactile sensation would be anesthesia. So different types of sensory loss there. So what do you do? Well, here I'm telling you about the treatment for surgery. Surgery, you would go in and you would cut that flexor retinaculum, and you would provide more space for the median nerve to go. So check out this surgery right here. This is an actual carpal tunnel surgery if you're curious of what this actually looks like. What happens if you break down the interossei on the lumbricals? Well, you're going to get another version of the claw hand to where the MCP joints are extended, but you've got flexion at the PIP, and the DIP joints. Last couple slides here for you. The Dupuytren contracture is a disease of the palmar fascia where it just shortens and shortens and thickens and becomes fibrotic, so much so that it would pull in on these fingers. So these fingers are being pulled in by that. Again, you can go ahead and surgically cut it so that it is released and back to normal. You can also fracture the hand very easily. The most commonly fractured carpal bone is a scaphoid fracture, because when you land, you typically land on your thumb, and that is in line with the scaphoid. Not a lot of blood flow to this area, so it takes a while to regrow with poor blood supply. All right, that concludes the wrist and the hand PowerPoint. Lots of muscles to look at, lots of different actions. Take your time going through this. As we finish the upper extremity, we are almost finished with anatomy. We've got 3 more lectures, and the lower extremity, my personal favorite to finish with. But I gotta go take care of this. Have a nice day.